doesn't enable the growth of bad bacteria.
So what can I ask the farmer that I buy from? What are the questions that I can go ask him?
They can test for bacterial levels. So one thing you could ask, and it's super easy to test for bacterial levels. So it would be like, because again, I come from the public health world, right? And so the biggest concern with regard to raw milks, it was not about the nutrients. In fact, it's very nutrient rich. It's just saying it's the balance between, because it's not pasteurized.
So let me ask you the question in a different way then. Say that you knew there was a good source of raw milk that was unpasteurized, that was untouched, that you knew was safe and free of bacteria because of the benefits of drinking that, knowing that it did not have the bacteria versus drinking pasteurized milk.
That I would, if you could take away the risk of the bacterial infection, Michael.
Just say,
if you can take that away, then the assumption is that raw milk, the nutrients in it would be wholer and more reflective of what mammals are supposed to get for their health.
The reason I asked it that way is I know, people have to make sure that the milk they're drinking is safe and it doesn't have bacteria and all that. But I think the pushback is because people hear raw milk and they assume that the pasteurization makes it healthier to drink. What the pasteurization does is it just makes sure that it's safe from bacteria.
That's right.
Correct? But a clean, good source of raw milk could be very nutrient dense and healthy to drink. Right?
That's right. And that's where, I think a good discussion, right? A good thing that the three of us just brought up is being able to put positive pressure on, raw milk providers on having measurements of bacterial counts.
Yeah. The reason I asked you is what I'm trying to share and make sure this audience knows is that raw milk, if it's a good source, is not unhealthy or worse, right? It's like the things that you outline, people have to be very cautious of. Right. You have to make sure you're getting it from a very responsible provider and storing and all that stuff. But I think there's a misconception online, especially where they just hear raw milk and they assume raw milk is not healthy for you.
Right. And that's why it's because of that. It's because of the bacterial counts and not really for the other reasons.
Let me ask you a follow-up. What are things that we're doing as humans to deplete our C15 levels? Like, what are there big no-nos? Is it alcohol? Is it lack of sleep? Are there certain things that you've come across like this really crushes those levels?
Yeah, for the most part, it's been our decreased intake of dietary intake of C15. The second is that the quality of the amount of C15, even in whole fat milk, has been declining. We also know that as we get older, our C15 levels decline. So even in Sardinia, who have 3 times higher levels of C15 than those of us in the US, even those, as they hit 100 years old, their C15 levels start declining dramatically. So now that the populations are getting older, we're seeing C15 levels decline for those reasons. So for all of those reasons, it's why, as far as like what do we need to do to get C15 back into our lives? The other good thing is exercising is shown to increase C15 levels. And that's believed because as long as you have C15 stored in your tissues, exercising helps to release that C15, get it into the blood flow, and let it go to work. And we can talk about, there's a lot of other fun things that C15 does aside from strengthening your cells. Please
talk.
So we created this pure ingredient with the Navy, which is fatty 15, and we put it out to the world.
And it's just one ingredient.
Just one ingredient, yeah. And this was all done in support of dolphin health, by the way. So it was like Eric, my husband, and I, physician husband, and I always joke about this is no humans were harmed in the making of this dolphin supplement. So it really was created to help supplement the dolphins' diet because unfortunately the fish have less fat than they used to have, and it's getting harder and harder for dolphins in the wild and at the Navy to get enough C15 in their diet. Waters are getting a little warmer, and the abundance of fish in the ocean is the same, but they're smaller, if that makes any sense. So as they're smaller, they're not as fat as they used to be. And so because of that, they have less C15.
I would think they would be bigger because of the GMOs in food. I would think they'd be fat fish.
Yeah, no, They're
Yeah, but where the hell? They're not like pulling up to McDonald's, Lauren.
Yeah, but people throw stuff in the ocean all the time.
Yeah,
You would
but
think
not
that,
that
or
much.
there's
Right.
plastic. They're eating microplastics.
Yeah.
I think they would be fatter. That's
The plastics
confusing.
maybe, but they don't have
Is
access
that
to our
not
food.
confusing?
Yeah, it can be confusing from a fish, from a like survival standpoint. If you have to turn around fish, like if fisheries are getting overfished, for example, then they will reproduce to kind of refill as long as you don't reach a certain threshold. But they're going to reproduce faster. That just means you have a lot more smaller fish. They just aren't given enough time to get older and accumulate fat, and they have less need for fat because waters are warmer than they used to be, and so they just don't need as much fat as they